My name is John Sapper. I'm the president of the Board for Alcohol and Drug Care Services. It's an honor for me to be here today as we recognize, honor, and celebrate the man who had the vision and fortitude to bring Waterfront Recovery Services to reality. It's also fitting that we thank John McManus today on the 4-year anniversary of the opening of Waterfront. When I was asked to join the board, I found an organization that was in rapid growing stage, beyond passionate about the work, with a leader who eliminated the words, "It can't be done," from the dictionary. I met a leader who, in partnership with Dr. Ruby Bayan and the entire team at Waterfront, continues to believe, and correctly so, that they are making a tremendous difference in the lives of so many who have reached out for their services and support. More than 2,000 individuals have been served by Waterfront since opening in November 2017. I have been personally and professionally humbled by the dedication, commitment, and life-changing work that goes on inside these walls. You don't see the stories about this good work above the fold in local newspapers. You should. You don't see the stories on the 5 o'clock news, and you should. And you don't hear radio interviews about the lives that have been changed because of this work, and you should. You don't hear about the hard work that is needed to make sure the $2.5 million a year to keep the doors open is secured. It starts with leadership and a passion for the work, where no barrier is too big to overcome. John McManus has been that kind of leader for Waterfront. As president of the board, I and 2 other board members here today, Ms. Eileen McGee and Ms. Karen Wise, sincerely thank you, John, for always being forthright with us and not mincing words in what needs to be done to support Waterfront. We have a few individuals who would also like to say a few words here this afternoon. Today, Dr. Ruby Bayan, Acting CEO and Medical Director at Waterfront.
Actually, this is not for John. Johnny, thank you very much. You have an amazing father who did something for this community no one could have done. He took care of the most vulnerable, people with addiction and who were homeless. You have a brilliant dad who has the greatest visions and plans. Others thought it was crazy. Well, he didn't, and look where we are right now. You have a father who has a heart, a big heart, honest, loyal, everyone's friend, and very funny. And can be very fiery too, just like me. You have a father who loves you so very much and who probably gave you your good looks. And is the best role model anyone can ever have, especially when you have your own children. We love him so very much, that we named our program Waterfront Recovery Services, the John McManus Center. Most of all, he is my soulmate in mission, my beloved brother. And Johnny, thank you so much for sharing him with us. Thank you.
Nancy Stark from the Department of Health and Human Services, County of Humboldt, please come up.
Hi. For those of you who don't know me, I'm Nancy Stark. I'm the Legislative and Policy Manager for the County Health and Human Services, and I'm also Chair of the Board of Directors for Partnership Health Plan. And I was thinking last night that John and I have several things in common. We both want to improve the world and stand for social justice. We both believe in treatment and the human capacity for recovery. We both have limited patience with bureaucracy, but we're willing to do the work to improve our community. And we both sometimes cuss a lot when expressing ourselves. So when the opportunity to expand substance use disorder treatment in a logical and organized and regional way came about, boy, did we jump at it. For John, this was the opportunity that he had been waiting for, to lift quality, to raise the bar, to raise up what we expect treatment to look like, to feel like. And for me, I just wanted to make sure that everyone who needs access has it. So we worked hard. We went through reams of paper, and we cussed quite a bit. And now Waterfront is a reality. The drug Medi-Cal system is a reality. In no small part due to what John and Ruby were able to envision and to make happen right here in Eureka. Today, more than 300,000 people across Northern California have access to substance use disorder treatment. And I want to thank John for making Waterfront happen, for the countless lives that he's changed, and most importantly, for being my friend. Thank you, John. I want to thank John, I want to thank Ruby, I want to thank every single person who works here at Waterfront, and especially the courageous board of directors for Waterfront Recovery. And just thank you and congratulations on this wonderful anniversary. I love you, John.
Officer Ryan Swanson from Eureka Police Department.
Hello, for those of you that know me, I'm Officer Swanson with the Eureka Police Department. I want to talk a little bit about Waterfront. I've been doing this position for 3 years now, and when I first started, making the connection with Waterfront was one of my first goals. That's when I met Dr. Bayan, I met John, the intake coordinator. One of the things I will say about Waterfront is over the 3 years I've been doing this, they've gone through a few different intake coordinators. Now is Jamaica, who's been very it was always kind of frustrating on my part because it was kind of like I had to retrain their intake their intake coordinators to work with me. But Jamaica and I have done very well. I know she's always there to help me. But one of the things that has really stuck in my mind, and I actually saw a picture of it the other night on Facebook, is about a year ago, I had a young female who I actually grew up with her mom, who was running the streets, had a major addiction problem, and drug Medi-Cal wasn't a thing yet, was still on the way. And so there was no insurance. And so I went and talked to John and explained the situation to John, and John still took her in and got her in. She posted a picture on Facebook the other night of her and her baby as they were sitting there on the couch, snuggled up to each other. And that could not have happened without Waterfront, without John taking her in, and the work that everyone here at Waterfront does to help her overcome the addictions that she has had. I'm hoping for many more years. We're in year 4. I'm hoping for many more years of the working relationship with the Eureka Police Department, the City of Eureka, and Waterfront to continue helping people get through their addiction problems and make a better life for themselves. Thank you.
Mike Wilson, 3rd District Supervisor from the Humboldt County Board of Supervisors.
Oh my goodness, what a honor. I'm smiling because, sorry, can you hear me? I have a loud voice as it is, so you're just going to do with what we got here. John. So I'm smiling because for me, and I'm just going to get a little bit personal here, John actually has a piece of my brain. And it is so seared into my memory that I have to just express it and understand from where the sincerity of this comes from. When I was 16 years old, it was the winter of 1984, we were young punks, I guess you'd say. We played in bands together. I knew John basically from his bands, Dogma, I think it was. Right. So this is why it's in my mind, because at one rainy night at the Bayside Grange, John's band was playing, and it was moshed up, and people were having a good time, and I was just trying to cross over to their side to get close enough to see John's band, because I don't know, well, I'll explain in a second, if you've ever seen John play guitar in these moments, but in that time, when we were all younger and had more hair and other things, he had a big mane of hair, and he had that snarky sort of punk metal, that look that when he was on guitar that just was, it was like MTV, but like 100 times better, right? And so as I was crossing the floor, it was slippery. I slipped and fell. Someone knocked me over. I slipped and fell. My arm hit the ground. I heard this crunch. And I lifted up my arm, and it looked like a question mark, right? And in that moment, here I am at the edge of the stage. I look up, and there's John leaning down, just like this, just going at it, just like. And then that face, his face, is so seared into my brain from that most traumatic moment of my life. I just carry it with me, and it's wonderful. It's a beautiful thing, really. I couldn't imagine anything better, really, actually, in that moment. And I kind of put it out there because John, for me, has been one of the most authentic people I have ever met in my life. Like, absolutely authentic. We use that term so loosely these days. This is authentic. You're authentic. No, John is authentic, right? He is who he is. And that I knew from the very beginning of time that I knew him from those days, right? The most authentic person. So when a few years ago, not just some years ago, John came and asked for support for this endeavor that he was working on here, I have to say, as a leader, we don't know everything. And we just saying, just for whatever it's worth, we don't know everything. We have to rely on people all the time, experts, and people who know things. And we also have to rely on whether they're honest and authentic and all of those other things. Because there's a whole bunch of people with a lot of opinions, and there's a lot of smart people with a lot of opinions. But I have to say, the second John called me and said, come down and talk to me about this project, I'd like to seek your support, there is no question in my mind what I'm going to receive from this person is the most authentic, real explanation of how he understands the situation. And the other thing I know about John is that he surrounds himself with authentic people. So congratulations to you all, I must say, because that's what has created this place. It is an authentic effort and projection to create recovery in a community that needs it desperately. And I just want to say, that is what John is to me. So, I'm going to read this resolution that comes from the board, brother, and from the Board of Supervisors. Oh, I didn't introduce myself. Mike Wilson, Board of Supervisors, 3rd District. There you go. That's all you get today. So, here we go. Resolution from the Board of Supervisors of Humboldt County. Whereas John McManus is being recognized for more than 19 years of dedicated service in the field of addiction and treatment, and whereas John worked as an intake coordinator, employment assistance care manager, substance use disorder counselor, and at the beginning of his career, and whereas John was the executive director of the North Coast Substance Abuse Council from 2005 to 2007. Sorry, this list is long. And where John was program director of Singing Trees Recovery Center from the years 2007 to 2014. And whereas John has been the executive director of Alcohol Drug Care Services Incorporated since 2014. And whereas John was a critical part of the partnership with St. Joe's Health Community Investment to start the Waterfront Recovery Services. And whereas John has been relentless in his pursuit of improved SUD service delivery, program design, and content, and raising the level of SUD clinical services in our area throughout his career. And whereas John is described by coworkers and community partners as a visionary, dedicated, community-minded leader, and authentic, whose compassion and kindness has touched many lives. Now, therefore, let it be resolved that the Humboldt County Board of Supervisors offers this as a statement of thanks and gratefulness for all his hard work and commitment to our community and for demonstrating the power of recovery as an inspiration to all still in need of hope and guidance. And with that, I want to thank you officially from the Board of Supervisors of Humboldt County, but really heartfelt thanks to John, your brother.
I'd like to ask Karen Wise from our board to please come up and share some thoughts.
There is so much love and gratitude, not only in this building, everywhere for John McManus, but especially in this building. The staff here are incredible. They go above and beyond every day, and they adore you, as we all do. And so, in our adoration and our gratitude, we came up with a book for John McManus. And the staff wrote a collaborative poem, and I'm going to read it to you. A father and a fighter, dedicated to a unique vision. Fire in his musician's heart, fierce and filterless. A man who is passionate, inspirational, making a difference to those in recovery. Passion is his truth. The world will know his love. A filterless ball of fire, a lover, a fighter, a father. Uniquely visionary, fiercely inspirational, hungry, thirsty, sexy.
Thank you, Karen. Very nice. I'd like to ask Miles Slattery, please, the Eureka City Manager, to come forward.
Hello everyone, I'm Miles Slattery, Eureka City Manager. Hello John. I've known John for about 10 years. After hearing Wilson talk about the old punk days, I wouldn't doubt if we had some late nights together about 25 years ago too, but I don't recall those. You know, I'm not quite as authentic as John, so I don't have a problem with profanity, but I definitely appreciate his authenticity. I met John approximately 10 years ago when we were starting our CAPE program. It was at the beginning. A good friend of ours, Brian Millett, started a program for the city of Eureka. We really didn't know what the hell we were doing. We started with a drug campaign called Get Real, and that's where I first met John. He was instrumental in doing what the city is doing now as far as changing our outlook on how to help community members. He didn't tell us how to navigate. He told us when we needed to navigate. He told us who you needed to navigate with, and if not, to make sure that you get things done, because it's always with the best intentions to get what's done, what's right for the community. Anyway, Johnny. Don't forget your dad's a freaking rock star. And he always will be. Whatever we do, we'll continue to go on to partner with John. He's made a huge difference for our community, and he's definitely made a huge difference in my life. So thank you, John, and congratulations on 4 years. We have a proclamation from the city too. I'll get you. Thank you.
It's hard to believe that Waterfront is 4 years old already. Creating this place was such a labor of love for so many, but no one more so than John. Well, maybe Ruby too. It wasn't easy either. There were roadblocks thrown up and around almost every corner. But John is persistent. We all know that. And he had a vision for what could be and a passion for providing the level of care necessary in order to give people a chance to reclaim their lives and become what they are capable of being, the best version of themselves. For years, John looked for a facility that could be certifiable by drug Medi-Cal standards, because he knew it was just a matter of time before Medi-Cal would reimburse for treatment services. Many doors were closed, many leads turned unfruitful. And finally, there was an alignment of many factors that made Waterfront a possibility. A facility, funding, leadership, partnership, sustainability plan, and medical expertise, advocacy, and a willingness to try something new. Looking back, it is quite remarkable the amount of startup energy and effort that was required by so many in order to make this place a reality. Not only was there the facility and staffing, but new electronic medical records and billing systems, medical policy, procedures, social policy, and procedures, and that was just the beginning. I remember the many, many meetings, John, the energy, the passion, the tears. The common thread through all the challenges and setbacks is John's perseverance, passion, commitment, and integrity. And John will be the first to tell you that his is not the most important contribution. Dr. Bayan was the unicorn. She is the one with expertise, specialized skill set, and steadfast commitment to serve those struggling with substance misuse and mental health conditions. And John always sang the praises of his staff and the remarkable work that they did and they do day in and day out. We at St. Joseph Hospital are proud to have played a little part in the origin story of Waterfront, and grateful for the people who work here and the service to others, and grateful for John and Ruby, and grateful for the clients who are brave enough to do the hard work to recover. Well, that was written by Martha Shanahan, who couldn't be here today. And I'm a little tearful myself, John, but this was truly a labor of love. And back to our Serenity Inn days, you have always been a firecracker, always inspired me to be better and to do better for our community. And with that, I thank you.
Good afternoon, everybody. I don't know where I met John, to tell you the truth. It just seemed like I knew him. And I was trying to remember where it was I met him, and I think it must have been at Alcohol and Drug Care Services many, many, many years ago, when it was really not much more than a couple of beat up old houses and, people laying around wherever they could. But there was love there, just like there is everywhere John is. There's love. And I think that that's the core of it, and that's what makes this place successful, is that you can feel that, no matter who you are, where you come from, or anything like that. Where John is, that's where love is. And he has saved the lives of many people here. And everywhere he's been. I mean, the guy's kind of a pest in many ways. He would say, Sally, can I do this? Can I do this? Can I do this? And it's just like, okay, sure, John. Let me see what I can do. And we would go and try and write something and try to figure out the money here, or go ask this person here, do you think you could do this? And if you could do this, then we could do that, and so on. I mean, it was just one thing after another. And at the same time, all the houses are falling down, and Serenity Inn is falling into the ground. John is still out there hunting up people and bringing them in. I don't know where he put them, but he put them somewhere. And they continued on. And then when this place looked like it might be available, man, we all, got to do it, got to do it, got to do it. And I was ready to give up a long time ago, but the pest just kept at it. We got to have treatment on demand. We have to have treatment on demand. And I'm like, oh, you're a dreamer, dude. And what do we got? We got treatment on demand. Going into this thing about, we're going to have Medi-Cal. Oh, right, John. Medi-Cal can hardly do anything as it is, and it's now. And what do we have? We have drug Medi-Cal now, don't we? John was there first. I mean, he's just, John, you're the man. And regardless of what happens in the future, this place is going to be here, and love is going to be here, and John's going to continue to take care of people. So I thank you all for being here, but mostly I thank you, John, for being here. You're just a hero. There's no other way to say it. Thank you.
Wonderful comments today, and I think that if I could sum it up in a sentence, we've confirmed that John McManus is everything from a visionary leader to a pest. So thank you for that visionary leadership, and thank you for being a pest. As the chair of the board, John and I would talk prior to board meetings, and being on this board is one of the easiest board roles that I have ever held. John told me what needed to be done, and he was always on target. So for that leadership, I thank you. Continue to be a pest with me, John.
I am so grateful to my friend, Dr. Ruby Bayan. Without her, none of this is possible. What we did here, none of it would be possible. She had the courage and the strength and the commitment to fulfill the mission here. And 95% of this place is my friend Ruby. Well, not that. That's my percentages are off. The wonderful staff here. And we've been through this together. All of this is a team effort. I look out and this is a room full of people who are committed to to making the community better, to just putting your head down and doing the hard work, because it is hard work. And it was my honor, my absolute honor, to share this journey with you guys. It really is. All of you. I would go through and thank everybody individually, but I don't have the air. But just know how special you all are. And it's just wonderful to have people. They're doing it because the world is, we're in a bad spot right now. Our community's been in a bad spot for a long time with drug abuse and homelessness. But we're on the right track now. And that's, I think I'm running out of oxygen. I don't want to sit here and jabber, but I know that I love you all from the bottom of my heart. And thank you for all of this. It's more than I could have ever wanted. If I cry, I run the risk of dying. I'm serious, isn't that crazy? So I don't want to cry. But I won't. Thank you all very much for coming here. All right, I'll shut up.
I love him very much, and I don't know what to say, but I love
That's
you so
enough.
much.
I love you.